Hello, everyone. Good afternoon. I just would like to ask someone to type in the chat box. I just want to make sure that you can all hear me. All right, thank you. Thank you so much. Wow, everybody's paying attention. So good afternoon. My name is Effie Battis. I'm from the Audacia Foundation. We are one of the workforce investment organizations in New York State. We've been working with a number of home care agencies over the last 2 years while we've been doing our workforce investment initiatives, and most recently during this pandemic crisis. We have with us today again, I'm going to introduce our speaker in a minute, Ann Frisch, who was kind enough to come and give us an update 10, 12 days ago when home care updates were becoming available. Since then, a lot has changed and evolved, and so we thought it would be useful to come and talk to you again and get from you any information, not only provide you information, but also get feedback about what are continuing issues that you're still seeing. We are keeping everyone on mute just because there tends to be a lot of background noise. So please, if you have questions, use the chat box. You can either send it to one of us directly, the panelists, or you can send it to all the participants. So please feel free to send questions either privately or to the public. So let's get started right away. So again, we want to provide you with all the regulatory updates for home care providers. I want to thank Ann Frisch for being with us today. She has really a plethora of experience, 30 years in the post-acute and home care service arena. She has a bio that is worth reading, but I'd like her to start right away. But needless to say, she's been through several crises before: Hurricane Sandy, 9/11, labor strikes, Ebola. She's held various board positions. So she has quite a bit of expertise. That being said, we recognize and just need to acknowledge the work that your agencies and your team are continuing to do. Saying thank you really rings hollow when we really think about what you and your staff are doing during this crisis. And so in the limited role that we can, we want to at least support you with information, education, and be a resource to you as best as we can. And so with that, I'd like to turn it over to Ann.
Thank you, Effie. And if someone could just type in the chat box that they could hear me, that would be.
I can hear you.
Okay, great, terrific. So I didn't want to go on a long tirade and then find out that no one could hear me. So
Right.
I just want to first start off by saying that I totally agree with everything that Effie said, not about me per se, but about the commitment, the sacrifices, everything that all of you are doing. And it is really, really heartwarming to see how time and time again the home care teams in New York step up for this, and this probably is of the greatest magnitude of anything that we have seen prior. But I know that we as a team will get through this. And I feel privileged to be working with the Audacia Foundation to be able to support you through this crisis as well. So I just want to take a minute to go over the objectives for today's call. And I'm hoping that this time our call could be more interactive towards the end, as we can only assist you based on getting feedback from you in the home care industry. So we have a lot of resources, a lot of people, a lot of experience, and it's really important as I go through some of these updates for those of you on the call at the end to really share with us what is going on in the trenches, because we hear a lot, and we hear a lot from HCP, we hear a lot from the Home Care Association. I do speak to some of you, but we're really interested in what your days and nights and weekends are like so that we could continue to offer value-added support and services. So first, I'm going to go and talk a little bit about the recent updates from DOH, CMS, and the CDC for management of our patients and employees with COVID-19 or with people under investigation. The information, as you know, comes fast and furious. And I often take a step back and say to myself that if I were in some of your roles as administrators, managers, supervisors, I don't even know how I would begin to have the time to cull through all this information to take out the important information, which is part and parcel to the reason that we've taken on a role like this, so we can put right at your fingertips this information. I want you to be able to discuss with us the provider challenges of managing patients, providers, and agencies during this pandemic. I'd like to get a better idea of the obstacles in maintaining services and discuss what additional resources might be needed to alleviate the barriers to care and to services, and how we could, amongst ourselves, share best practices and the challenges in maintaining essential home care services. And then again, leave you with some of the credible resources which are available through a click of the link on the presentation to take you to information that could be valuable to you as we move forward. So just in the way of updates, and I'm sure you've all heard it, because if you listen to any of the press conferences of the governor, of the mayor, the news, you know that the New York State is on pause, and that's been extended, which means that all non-essential workers must continue to work from home in schools, and everything will be closed through May 15th for all non-essential business. All New Yorkers must wear face masks in public to further limit the transmission of the coronavirus, and all essential businesses or entities, which I believe is where we all fall in, any employees who are present in the workplace shall be provided and shall wear face coverings when in direct contact with customers or members of the public. Insofar as the home health aid training, the New York State Department of Health is waiving the requirement that 8 hours of the 16-hour practical training portion of a home health aid training program can be provided in a patient care setting. The training may now take place in a skills laboratory under the direct supervision of an approved nurse instructor. And a minimum of 16 hours of classroom training is still required prior to the start of the supervised practical training. The home health aid training program, including classroom instruction and supervised practical training, must total at least 75 hours. So there's been some relief in this area as to how to go about the training. The time in which a home care aid training program must be completed has now been extended to 90 days. And the alternate competency demonstration look-back period is expanding from 2 years prior to now 3 years. And prospective employees must have 3 months experience rather than the traditional 6 months. So the requirements are loosening up to be able to bring people in and get them on the front lines to work. The period in which home health aide training programs must submit and extend to submit a class schedule to a regional office is extended from April 1st, 2020 to July 1st, 2020. Annual health assessments have been temporarily suspended for all employees, and I myself found this somewhat ambiguous and did some additional research to better understand what that meant. So the annual health assessment is really the questionnaire. Okay, so we don't have to go through the questionnaire. However, for employees that still required a PPD, that is still necessary to be done. New employees may have their health assessments completed by telehealth or by an RN, and they must follow guidelines in place for all staff, including daily symptom screening and at least daily temperature checks. Now, just going back to this as well, one of the questions that I had when I read the guidance was, did this mean that new employees didn't need to submit their immunity to MMR, varicella, etc.? That at this particular time has not been waived. They still need to meet those requirements. And this update in guidance is really just about the health assessment. After speaking with the Home Care Association, they do feel that if this continues for an extended period of time, that those other requirements may be waived. So just so everyone knows what's acceptable and what is not. And annual performance evaluations of current employees by home care agencies and programs are temporarily suspended. So just one little small thing that you don't have to worry about right now. Now, you probably can all talk to me a whole lot better about the DOH Daily LICSA survey, and I've spoken to some of you, and I know that it's one more mandate that you don't have time for, and you're required to fill this out and submit this every weekday by 1 o'clock for each separate license number that your agency operates. And for any of you that have not received this, check your spam folders and make sure you add no reply at salesforce.com to your address book so you can get this information. While some of this may seem like busy work, I've been told by the department that the survey is intended to collect information that will enable the department to better understand how the COVID-19 virus is affecting the provision of care by your agencies and the industry as a whole, so that they can continue to make informed decisions about the state's response to the pandemic. So one of the things that recently has changed in the nation's understanding of COVID-19 is that it is now believed that up to 25% of the spread of COVID-19 is caused by pre-symptomatic or asymptomatic transmission. And I know when we look back into early March, there was a lot of discussion about how masks or face coverings were not necessary for the public. However, now that this has come out to say that a quarter of the spread of this disease is by asymptomatic people, they're now requesting these face coverings. So in this, the New York State Department of Health is recommending that the local health departments identify contacts to a confirmed or suspected case who had exposure up to 48 hours prior to symptom onset. And that's where our home care providers really come in. If you become aware of a patient, a family member, an agency, someone that's affiliated with your agency that is a confirmed or suspected case, really important to get in touch with the local health departments. Close community investigation in the community are things like someone that shares the same household, someone that has direct physical contact. So if there's someone caring for someone in a home, whether it be a family member or a home care person, that's considered direct physical contact. Direct contact with infectious secretions of a COVID-19 case. So if you're coughed on, if you're touching used paper tissues with a bare hand, and again, within 6 feet of a case for 10 minutes or more. And I know that we've heard repeatedly that there's some specialists that are really concerned that the 6-foot distance might not be adequate, and this may be transmitted with even greater distance. So again, if you know of a close community contact that's been in direct contact with someone that meets these criteria, it would be helpful to share that with the local health department so that we're able to slow the spread. Because as people get back to work and we resume some of our normal activities, it will be even more and more important that we get and investigate those close contacts. We talk about, and this seems to be the biggest concern and struggle for providers, and what the DOH and the CDC is recommending when PPE is in short supply. And I know that last week I called and spoke to many of you about this, and everyone shared the same sentiment that there is just not enough PPE to go around. We are not necessarily following infection control protocols that we've previously had in place for airborne transmission. And the DOH has gone so far as to say that you should continue to submit your request for PPE through your local OEM office. However, if unavailable from them and you have no contracts or vendors available to order, you should refer to the CDC strategies for optimizing the supply of PPE. And here in the presentation, which we will share with you afterwards, is a direct link. Again, you can just click on it and it will take you to the site. I don't want any of you to think that you're in any way, shape, or form being left out of what the OEM is offering. I've tried myself to get in touch with the local OEM office. I've had many providers tell me. I've sent an email to the local OEM office to see how we might be able to ramp up supply delivery to our vital home care providers. And I have not been able to get anyone to respond to me. So I question, at least up to late last week, whether even though the DOH does continue to say that we should contact our OEM offices, that they actually have supplies to disseminate to us. The Department of Health also recommends that facilities and providers need to plan and prepare for the unavailability of PPE. And I know a month ago or 6 weeks ago, you know, this just hit us from nowhere, and we were really struggling as to how to get by with limited or no PPE. I think that now providers, and I do want you to share with us when I'm finished, I think we might be in a slightly better place and at least have found some substitutes or some viable alternatives, although not necessarily where it needs to be. If we are implementing crisis strategies, the Department of Health is recommending to protect yourself and your staff from any vulnerability related to litigation or any questions after the fact, to document your inability to follow conventional or contingency strategies. I was on an infection control webinar the other day where it was very clearly stated that we need to consider ourselves in a wartime type environment. And as such, sometimes during wartime, we don't necessarily do everything optimally. We do the best that we can. And well, for many of us who adhere to mediocrity doesn't work for us, particularly in healthcare and when caring for others, I think we need to acknowledge that some PPE or some substitutes for PPE that would traditionally be used in better times is probably better than no PPE. And as a provider and a professional myself, it does pain me to have to say that, but I think that we need to put it in perspective to where we are today. And something else that they've recommended was, if possible, and again, this is an administrative burden that perhaps on a daily basis you don't have time to do, but develop written protocols that maximize the safety of patients and healthcare providers, but also knowing that it may not be optimal, because down the road, if you are surveyed, you just want to make sure that your policies match what you've been instructed to do. This was something that I came across that I think might have better use in a facility, but for those of you that might be struggling on never quite knowing how much PPE to order, if you could even get that far, and how much you need, there is a document and a link on the CDC website, which basically allows you to utilize your PPE equipment burn rate calculator that will assist you in planning in optimizing the use of PPE for response to COVID-19. So you know that if on any given day for the past week, you've served X amount of patients with COVID-19 or persons under investigation, and you're providing your staff with the necessary PPE, you could plug that all into a spreadsheet, which you could link to at the bottom of this page, which will give you the burn rate. So you're not just shooting in the dark at what you need to offer. You're actually using data to drive your decision making. And because PPE is expensive, and also because it's hard to come by, this could be a value added. I found it very, very interesting. And if anybody needs help navigating through it, I'd be happy to serve as a resource to help you with that. But I think that it was a valuable tool. And we have heard from you loud and clear as we struggle on a daily basis as to how we could be a better resource and support for you. And one of the things that has come out of this is that you just didn't know where to turn for PPE. So what the Audacia team has done is has done a deep dive into suppliers for key COVID supplies. Now, what I'll say at this point is that these items available change, I don't even want to say on an hour by hour basis. They change on a minute by minute basis. But all of these companies that you see listed in this 2-page supply list, at one time or another, had these supplies and was ready, willing, and able to ship them out. We at the foundation did the very best that we could to obtain information about these vendors. But I do want to caution you, and I actually myself, I've ordered from some of them for my own personal use as well, and they did deliver. But you know, there's all types of organizations out there looking to capitalize on this pandemic right now. So we just have to make sure that we're dealing with credible resources. Based on our deep dive, we feel that is the case, but we have a disclaimer at the bottom, just so you know that we haven't necessarily done business with all of them. Places like Amazon and Staples and Hopkins are well known to everybody. Some of the other places you may be familiar with, you may not be, but they are here and you are free to call them. We have all the contact information, and basically the quickest and easiest way to access supplies from them. So we hope this is helpful. Many of you may have already received this directly to your agencies. We will continue to update it as new vendors become available, so that you always have a running list and a group of companies that you can turn to at least attempt to get the supplies that you most need. Just a little bit of a reminder, we had talked about this on our call on April 1st, but Medicaid, New York State Medicaid has really stepped up to agreeing to pay for telehealth or any means of telecommunication when providing aid supervisions, orientation visits, and they are reimbursable as visits. And state Medicaid is also saying that any and all visits which are not essential to be done in person are encouraged to be done by remote communication. Now, you know, people have talked about some of the HIPAA issues, because prior to this, agencies were not permitted to use something that was not considered secure. The Office of Civil Rights has actually loosened up some of those requirements just to make more items available to providers. The intent, again, is to give you greater flexibility in using things like Zoom, like a Skype, like FaceTime. However, understanding that you need to do whatever is in your power to minimize any other HIPAA violations. It can't be just careless and reckless. So I thought that, again, it was important to mention the great role that Medicaid has taken in helping us during this critical time. The last thing I want to talk about, and it may be a little bit premature, my colleagues at Audacia and I have been trying to get some updated information about this over the past few days. It seems like the guidance, the eligibility requirements keep changing, but I don't know, maybe perhaps, and I'd like to hear from you when we're finished if you've heard about this, but apparently the city of New York is in the process of making hotel rooms available to workers and volunteers responding to the spread of COVID-19. And these hotel rooms may be reserved for healthcare workers who prefer to stay in an isolated setting for reasons related to this outbreak, but do not have access to one. And it goes through the eligibility. So those employed or volunteering to actively care for and or provide services, either clinical or non-clinical, in healthcare, community-based or home-based settings within New York City. There is a link which I've listed below that you can select to make your hotel reservations, fill out the requested information that they're asked for. And they said that reservations are made as they are received, but they take about 24 hours to process. I actually tried to reach out to hotels@oem.nyc.gov yesterday to see if I could get more information, as I was curious if individuals were going to be placed in locations that were in the same borough as their home or where they work, if there were going to be meals provided, if there were any efforts to deploy social distancing in these hotels when people are in the elevator or whatever. And I I received an email back this morning basically saying that more information would be available on 4/22. So I guess my parting message is to everybody is start thinking about this. If you've heard of staff or employees that might meet the criteria, and hopefully by tomorrow we may have some additional information. And when we do get it, we will be the first to share it with you. Again, you may recognize this from the last time we spoke. These are the links to just about anything that you and your staff need to know. Any of these sites, if you go to, there's a search button, so you can use that and go directly to a site that's relevant to what you're looking for. I also do want to add that, you know, in our efforts to help and support you all through this pandemic, we have set up an email address at the Audacia Foundation. If you have any questions at any time, if you're looking for some guidance and you can't find it, or you don't have the time to find it, or it's confusing, please shoot us an email. That is the least that we can do for you during this very difficult time. And we will dig down to try to find the information and get you what it is that you need. So thank you for taking the time. And I see that there are some questions that have already hit the chat box. However, what I'd like to do, and Lilia, maybe we can ask some of the providers if they would like to share with us some of the challenges that they are experiencing on a daily basis, so that perhaps we can find ways to address them.
Thank you, Anne. If someone has to share something, if you can please click the button where it shows to raise a hand, and we can unmute you so that you can share your thoughts.
We would really like to hear from you, even if you have a best practice. Has anyone been successful at overcoming the PPE shortage? Is there anyone on the call that can share with us any best practices that you may have employed to help support your staff during this difficult time? Are you doing any type of recognition programs, or are you just too busy to deal with that? And what do you think that the staff needs right now? Madeline, I see that you talked about offering free telehealth to all employees via Teledoc. Do you wanna just talk about that for a moment? Okay, since we're not really I don't know if there's a technical problem or not. Lily, do you want to go back to the beginning to where the question started, and then I can begin to address some of those?
We need to unmute. This is Effie again. Hi.
Hi.
Lily, if you can unmute, well, I see Eileen Rabinowitz has her hand raised. So if you can unmute Eileen and then unmute Madeline as well. Thank you. Well, first Eileen.
Okay.
Hi, can you hear me?
Hi, Eileen.
Hi,
Yes.
I'm using this on my phone. Okay, so I like the point you brought up just now about acknowledging people. So we're trying to like keep an anecdotal list of different situations where we want to acknowledge people, and we will after the fact. Best Care already has a annual program that we've AIDS of the Year in different categories. So we'll include that. And we've also, I didn't know about that, just as an aside, about that hotel, and we've already actually paid for some aides to stay in hotels because they're fearful to go back to their family.
Oh, wow.
That's, something, I'm very happy that our president saw fit to do that. I mean my Best Care president, and nobody else. So the big challenge is PPE, and we've tried different things when, we always supplied soap, so we had enough to start with, but as it started running out, we've been ordering dish soap to fill containers to give people, and now that's running out, and now a big challenge is still gowns and N95s and face shields, because we are willing to take COVID positive patients, but it's a challenge to make sure the aides are properly equipped. And we're concerned about substituting things and the liability, and also putting people at risk. So that's really our biggest challenge. And now I guess you all know that gloves are starting to run low. I don't know if I'm repeating things people already know, but we're concerned about the glove supply. I don't know if anybody else has that issue. And I guess that's all I have to say. So we're struggling just like everybody else. But thank you for that information about the hotels, because that's really been a challenge, moving home care workers from borough to borough and making sure that they're safe.
Mm-hmm.
So we'll hopefully be able to utilize that.
And then this is Madeline. I think you unmuted me, so I hope everyone can hear me.
Yes.
We can hear.
Yes, we can.
Great. Yeah, so the piece that I submitted is that we actually are now offering from my organization free telemedicine to all of our employees. It's a program through Teladoc called Healthiest You. And originally we had this in tandem to our benefits for our full-time employees, so our administrative staff and our group of HHAs that work for us over 30 hours a week. But I wish I knew the pricing on this, but our HR department was able to strike a deal with Healthiest You to provide coverage to all of our employees, even those working part-time or those who have had their hours completely cut because they're either no longer able to work or they have had health scares themselves. And what's nice about this is everyone actually can get a free primary care visit, and all the other services are free for both them and their family members. And the reason we made this choice is because we found that many of our home health aides working for us did not have a primary care provider or access to get one within a short period of time when they were experiencing active symptoms.
So Madeline, I'm just curious, do you think that has alleviated some of the fear and concern by some of the staff?
I do think so. We've gotten feedback already from 2 or 3 people who have used it in just this past week, for both themselves, and for one of them, she used it for her husband. I think one barrier is obviously the figuring out how to use telehealth and being tech savvy enough to set up like a video call. But for our home health aides that have been able to. We've gotten a lot of positive feedback on just being able to speak to someone. And additionally, in addition to like the medical side of it, they offer mental health support, which I think is something that a lot of people could use right now with either cut hours or feeling sick themselves, or it's just a very tough time.
Yes, absolutely. And just to add to that, the Audacia Foundation is currently exploring different ways to address the mental health component of this pandemic. We were on a call yesterday. We have some excellent resources that we're working with to help develop a program, if you will, to really help providers, all the way from administrators down to the frontline staff during and after this crisis, because I think that the implications of this all are going to be around long after this period is over. So hopefully you'll be hearing more from us in that regard. Something we feel very strongly about and want to be able to help address it. In terms of other challenges, anyone want to speak to other challenges that you are having? I know I saw someone type in again about the PPE and that you've been trying to reach out to the Office of Emergency Management, as did myself and many others, and no response. And I would just say, you know, it is absolutely fruitless to continue to do that if you're not getting anywhere. And we need to resort to other methods. Audacia, to its members that we work closely with, have been able to offer some PPE on a limited basis. However, the list that is in the presentation is pretty comprehensive, and for the most part, all day, every day, I do receive emails about supplies that are available. Today I just got something about big Purell bottles from Office Depot. They have big Purell bottles, so not ideal, but if you were desperate, you could take those Purell bottles and pour them into smaller bottles and disseminate them. And I also saw someone asked, if everybody's working remotely, how are you getting the supplies out to your staff? There are some agencies, I know the Visiting Nurse Service had talked about this on a webinar they held, and some of the other providers which are mailing them to the AIDS homes. Also, I talked to other providers who had leadership in their organizations driving about and dropping things off at key areas for aides to pick up. Not ideal, but again, we need to ensure that the staff have the tools that they need to do their job in the least difficult manner.
We have another hand raised, Ross.
Hi.
Okay, hello.
Hello, can you hear me?
Yes, we can hear you.
Good. So you actually answered my question regarding these requests to Office of Emergency Management, because I sent this request twice. I received no feedback at all, and I just wanted to double check if everyone is in the same situation, and maybe if there is any special way to submit such request, because I was doing it through form that is available at their web page. Was that a correct thing, or was I supposed to do it in some other way?
No, I think you did it in the right way. I have heard repeatedly that there are not responses to this. And I know that people have also called DOH to report this, but there doesn't seem to be any real action that's taken as a result of that. So again, what I think, is we kind of need to go outside of that realm. You could still continue to send to them requests, because who knows, maybe someday they'll respond and you will be able to get some. But in the meantime, I think that we might be counting on something that may not materialize.
Thank you.
I see that Judy Aponte, I see that you asked if we're able to do fit testing for our home health aides. I will defer that to Barbara or Laura or Effie on the line.
Sure. What we would recommend, as we've all become advocates of online or telehealth learning, is we will give us the opportunity to preview some online resources that would be that we could vet as far as reliability, and we'll send that out to everyone so that you can also then share that with your staff so that they can, as best as possible, fit the mask remotely. It's not ideal, but it would give some guidance for helping staff. So let us do that, and we'll share that resource with you.
Terrific. That's great. To the individuals that asked about New Jersey licensed RNs able to work in New York State, several weeks ago, it was made known that if you're licensed anywhere in the country, you can work in New York. Actually, you can, if you're licensed anywhere in the country, you can work anywhere in the country as long as you have an active, unencumbered nursing license. And you see people coming from out of state to help New York all the time. So absolutely, if you are fortunate to get anybody from New Jersey to come work in New York, only because we here in New Jersey are struggling also with enough manpower, but that is totally acceptable. Is it necessary to wear gowns in the home as well as gloves and masks? We do home infusion. In an ideal world, it is absolutely important to wear gowns in the home as well as gloves and masks. However, as I've alluded to earlier and in much of my conversation with infection control specialists, we don't always have the ideal gear that we need. If you don't have a gown, you can wear coveralls. If you don't have coveralls, you could wear an apron. You should be wearing gloves, and you should be wearing a mask, or at the very least, some type of face covering. Again, the consensus from our infection control specialists and even the CDC is that if we can't follow optimal policies and procedures and things that we've known to be optimally effective in good times, we need to do what we can do. But that doesn't mean that everybody goes back and says, oh, well, we can just we'll just give everybody a bandana. We need to make concerted efforts and document those efforts to get the supplies that we need. But we understand that it's not always possible. So we want to put our best efforts forth. That's, again, one of the other reasons that we've taken the time to develop this whole list of suppliers, and we will update it because we could be compromising our staff by not having the optimal equipment. So we want to do our very best to get it. Effie, do you see any other hands up?
No, but we have some questions in the chat box. Would you like to read them, Effie?
Sure.
I have been going through some of them.
Okay, good. All right, I'll let you continue that.
Okay.
Then. Yeah, that's fine.
Okay. The slides and the recording will be available after the webinar. Lilia, will you be sending that out? Yes?
Yes, she will.
Yeah.
Okay, very good. Perfect. Let's see, there was mention that NOC was going to request of CMS the approval to do an abbreviated OASIS. Do you know if they did that? As far as I can read, and I am deep in this on a daily basis, I have not seen that, although what I have seen and what I know has been put in place related to OASIS is that you have greater than the usual 5 days to complete it, and there is no longer any timeline on transmission. Okay, but understand that if you're not completing the OASIS and you're not transmitting, that you're also not going to get paid. Okay, so they go hand in hand. But I did not see anything related to the approval of an abbreviated OASIS, but I am going to write that down. And let's see, who asked that question? Sharon Phillips. Okay, I am going to see if anybody has any more information related to it. Okay. Yes, Jeannie, I know we see the cost of PPE all the time, and while we've heard repeatedly that price gouging is unacceptable, there are, again, still companies that are taking advantage of us during this crisis. And I know you don't have a lot of time to deal with the details of that, but there are places where you can report them, and I encourage you, and you could do it all online, so it doesn't necessarily take a lot of time, but I would encourage, when you can, to report them, because it is just unacceptable. The owners of the licks I work with are able to get supplies from Amazon. They seem to be able to get adequate supplies, but these are small lixes. A lot of staff are using their own masks that they launder at home. And yes, again, that has been the direction of the CDC. Okay, if we've tried through all possible measures to get what we need and we're not able to, the staff can use their own masks. And, you know, again, like they say, something is better than nothing. The CDC has also recommended that if you have a COVID positive patient or a patient under investigation, that, and you only have, let's say you only have one mask, the healthcare provider should wear the mask and have the patients wear an alternate face covering. So lots of, you know, tough decisions that we have to make. We have a staff member available to assist aides concerns up to 10p as well as for, oh, okay. So in other words, Jeannie, I think what I'm hearing you say is that it's kind of like a little, maybe like a hotline where people can call in if aides have concerns. Can we unmute Jeannie and maybe have her share what they're doing?
Yes, give me 1 second. Jeannie, you're now unmuted.
Did we lose Jeannie?
No, we didn't.
She
Jeannie,
probably can't unmute herself.
I am unmuting her.
Okay.
She's probably not connected with audio.
Okay, let's continue with the questions.
Yeah,
then.
okay. Jeannie, actually, if you want to drop me a note, you let me know what you're doing and I can share it with the group. Leah asked, can you give me some more information regarding the suspension of the annual health assessment? You briefly mentioned it. So the health assessment is really just the health questionnaire that you ask your employees on a yearly basis. That is something that has been suspended at this moment. However, there is no suspension for the PPD. If you have an individual that has a positive PPD and a negative chest X-ray, you ask that annual health assessment related to have they had night sweats, losing any weight, so on and so forth. So it's really just a brief health assessment, but the actual requirements to ensure that the people that we're sending in to the community are free from communicable diseases is still in place. Although HCA told me earlier that they felt that this could be something that might be temporarily waived as well, but that has not happened as of yet. So make sure you're keeping your people on schedule for their PPDs or sending them to a lab, primary care doctor to get their PPD, and go from there. Our staff need to have face shields and N95. In an ideal world, if you're taking care of individuals that are confirmed positive for COVID or patients under investigation, yes, face shields and N95s. And I'm hoping that you are able to get those. Again, the list that we provided had some vendors that did have face shields and did have N95 respirators. Hi, Tammy. You're asking in home care home base, this is 66 visit. Yeah, the federal government is now allowing nurse practitioners to sign off on home health orders during this time. Okay. It applies to all the states. So we can have nurse practitioners sign off on home health orders. Okay, we did that. When all the office employees are working remotely, how are you getting? We talked about how we can deliver to their homes. We can mail it to them. We can set specific drop-off sites around the city. The family, Jeannie, the family insists on care in their home. How are other agencies dealing with this? We are aware of priority levels, and at the same time, in a shortage of aides, especially in Suffolk, aides are now being approved for unemployment due to no childcare. Wow, anyone have any feedback on that? We know that there's shortages in some places because we have a large amount of people out ill taking care of their kids, and in some cases with the new unemployment benefits, that actually might be more lucrative to some of the aides than actually going to work. But anyone have any suggestions for Jeannie? Okay, if anyone would like to share any of that information, you can send it to our COVID response. We have about 2 more minutes left. Let's see, trying to get home health aide that tested positive and are now ready to come back to work, another test. I'm just curious where they received their initial test, and could they go back and get a repeat test? I know that testing still is a huge problem. Pretty much all over the country, but a real significant problem in New York City. I think that all of our governor and our mayor alludes to that frequently, and one of the reasons that it's going to be hard to get people back to work because of the lack of availability of the testing. Could we discuss best practices for 24/7 care clients that test positive or suspected positive? My organization does not provide live-in home health aides, so this results in many different people being exposed, especially if the family doesn't step in. So, you know, again, there's not an optimal solution to that, but what I would say is that the aides that you use for patients like that ideally could be aides that have already had COVID-19, or that you limit the group of aides to a subset of your aides. So you're just not having your entire aide workforce going there. Because you do want to, where possible, consider having a group of aides for COVID positive patients and a group for those that are not, although I keep saying that we need to consider all of our patients as being potentially infectious and still actually follow good infection control. The hand sanitizer dispensers, the list that I gave you should help. Strategies for aides who refuse to care for positive patients even when we offer proper PPD. Aides are very scared, and absolutely that's a huge concern. And I would say that that probably is an issue that you need to take up with your HR department. It's bigger than any other HR issue that we've had before. But your HR folks would probably be the best people that could guide you in that course of action. Immediate care has been doing fit testing in some locations. How they do charge and you need to schedule. However, they do charge and you need to schedule. Good to know. Thank you. All right. Well, I guess our time has pretty much run up. I don't want to take any more of your time, but I think we can send out some of these other questions and comments and encourage your feedback.
And we could, it's not like we're going to be cut off if you want to try to address a few more.
Oh, okay,
But I
very
know we
good.
don't want to be like, it ends and everybody's shut out. So it will run for a few more minutes.
Okay, perfect, great.
Okay.
All right, so Leah asks if, from Anne Marie in Western New York, does this apply to home health aides, the immediate care doing fit testing? And Anne Marie, could you answer that?
No, I think the question relates to having an HHA from New Jersey work in New York.
Fit testing.
Alluding to having HHA work with New Jersey HHA in New York. So can an HHA from another state work in New York?
I have not heard that, but I will take that question for follow-up. I think the actual requirements might be different, but I will look into that. Work in New York, okay. Is anyone offering incentives for home health aides working with COVID positive clients? Interesting. Any of our providers on the line doing this? I know I saw a proposal, I guess it was last week, maybe from Chuck Schumer, that said that people that were on the front lines now should be getting incentives and combat pay, so to speak. But I don't know that it's ever come to fruition. But anybody offering it independent of that?
Excuse me, Anne, Eileen wants to talk.
Okay.
Hi. I know 1199 is working on something, and my agency is 1199, and we also just as an individual agency are looking at that. And it should be in place, I guess, by the end of the week, some kind of a stipend to support the home health aides who are taking the COVID positive cases. And we do have, I just want to add two things. We do have aides that don't want to work with COVID positive patients, and our policy is we are telling them ahead of time, we're ensuring they have the supplies, and we are not, there's no retribution if they don't want to go to the case. We do everything we can, offering a place to stay, stipend, etc. But we do not, there's no retribution if they don't. And also, one more quick thing about the OEM and supplies. Anybody has an agency in Nassau County, they've been wonderful. They may not get everything we need, but we've gotten 3 deliveries from them. Once we had to pick up, twice they actually delivered to us. So if anybody's in Nassau County, Nancy Fisher, I think, heads it, and they've been very helpful.
Interesting. Okay, what about anybody on the line from Westchester? Are you finding a similar thing in Westchester? Or are the problems just really in New York City per se?
And Sandy also has a question.
Okay.
Sandy?
Yes, I'm in Nassau County, and I would agree that OEM's been pretty good. They don't give us a supply, but they supplied us twice, and it's good. And on the incentives for people who are working with COVID positive clients, we are giving incentives to them. So the caregivers are getting up to $4 more an hour to be willing to take a case like that. But it's not making much difference. Most of them still won't do it.
Really? Are you having problems with patients letting you in the house if they're not COVID positive for fear that the provider will bring in the virus?
We've had that from existing clients, but they tend to be the clients who are more at a companion level.
Mm-hmm.
They can't really get by without us. They'd rather get by without us.
Right, understood. To the person that asked about the LICSA initial assessment and reassessment, yes, it can be done telephonically. And that was something that came out probably in late March. So the state does not want us in the home unless it's imperative to the patient's care. So you can do those assessments and reassessments over the phone. In fact, I also mentioned last time that we can do home health aide supervisions remotely as well, which, you know, is good from the perspective that we're not exposing people more often than they need to be exposed. However, we talk about this all the time, you know, it's a lonely place for people in home care, for patients and for aides. And, you know, I think oftentimes the aides look forward to having the nurse come and do the supervision and work with them. And so this is just one more instance where we're somewhat removing that piece from the plan of care, which is understandable why we're doing it, but just know that the aides might need additional telephonic support because of this change. Tammy, I can't really address the the home base RN 66s, but if you want, I mean, I can call Chris, or I can call one of the certified agencies and find out. I'm not that familiar with the nuances of home care home base. Yeah, and also the point of the aide receives $280 a week plus $600 a week, so that's $880. Okay, and it's supposed to end July 2020. Although if things continue along the current trajectory, I could see this going further. Can the agency get sued if the home health aide got COVID-19 from a patient? I do not know the answer to that, but I could definitely look that up and try to get some guidance for you on that. Okay. Let's just see if you got PPP funding. Use that money to incentivize aides any way you can to get them working. Yep, whatever it takes. Okay, anyone else have any other questions? Oops, another one came in. Is the Department of Labor providing the additional money? I do not know. Is that a question or a statement? I know it has a question mark at the end. Yes, I do not, I don't know, but I will definitely try to dig down and get some answers to that question. Thank you, Debbie. Okay, if there's no other questions, I just want to thank you for your time. Thank you for your insightful questions, and thank you for everything that you are doing to support the people of New York City and New York State. We really appreciate it.
Yes, and at the Audacia Foundation, we also, we really commend everyone for all the work that you're doing. We want to thank you, Anne, for joining us today. And we also want to thank all of the participants for sharing information and insights about what you're doing during this crisis. So we'll be in touch. We'll be back again soon with further updates. And again, please reach out to the email that we sent you if you have any questions. Thank you, everyone, and stay safe during this crisis. Thank you. And yes, we will be emailing the PowerPoint to everyone. Thank you, everyone, and stay safe.